When we talk about India's seafood exports, especially shrimp, one topic always comes up: antibiotics. India often tops the chart in refusals due to antibiotics. But do we really assess the why from a 360-degree angle? For more than a decade, India helped feed global demand at a time when global demand was exploding. When demand exploded, broodstock imports exploded, seed demand exploded, farm expansion exploded. Shrimp production grew more than 300%. Vinami became our crown jewel, and India emerged as one of the world's largest shrimp exporters. During COVID, broodstock supply chains broke. Disease outbreak was spreading like a pandemic, and other vulnerabilities rose. These are the global issues which every producing country faced. But India somehow felt them at a much larger scale. Why? India struggled more with antibiotics because of two structural realities. We have a highly fragmented, decentralized farm base. We have over 1 lakh small-scale shrimp farmers scattered across 9 coastal states, connected through thousands of middlemen, traders, transporters, and suppliers. Our rapid expansion outpaced regulatory services. Farm growth was faster than the growth of extension services, testing capacity, and on-farm training. Factories had strong controls, but farm-to-fork traceability was weak. This was clearly a policy blind. The repeated alerts from FDA, EU RASIF, and other markets made it clear that India needed a national, evidence-based antimicrobial resistance policy and a strong traceability shift rather than reactive firefighting. If we didn't do this, we would lose our market access, our credibility, and most important, our reputation. A fundamental shift happened in 2017. Government of India, with FAO support, built a national AMR surveillance system, the Indian Network for Fishery and Animal Antimicrobial Resistance. This system uses standardized sampling plans, uniform testing protocols, and lab methods so that the data from different states and laboratories can be compared to see clear patterns of risk. And when a refusal comes, the baseline AMR data and residue trends would help us identify high-risk zones and guide solutions to prevent it from recurring. So this moved India from reactive firefighting to systematic prevention. And if I can put this aptly, India rebuilt its food safety architecture. Now, what does this new architecture actually look like on the ground? It's not just one institution or one scheme. It's 3 key gatekeepers working together. First, at the farm level, we have the Coastal Aquaculture Authority. Second, in the middle of the chain is MPEDA, which handles traceability and pre-harvest testing. And finally, at the export gate is the Export Inspection Council. Let me just quickly walk you through how each of this system works. Coastal Aquaculture Authority is the farm level gatekeeper that prevents antibiotics at source. CA registers farms, creating visibility on who is farming, where and what scale. These farms are geotagged. CAA is responsible for stopping banned antibiotics from entering the supply chain by regulating the use of chemicals, drugs, disinfectants, and aquaculture inputs. CAA also registers hatcheries backed by biosecurity protocols and supported by broodstock multiplication centers. Now, CAA becomes our first layer of traceability. Next comes MPEDA. MPEDA is the traceability and testing backbone. It connects farms, traders, processors through farm verification, pre-harvest testing, and it is mandatory for farmers who are supplying to processors to get the pre-harvest testing done before harvest. MPEDA currently operates a network of around 16 ELISA screening laboratories, with ELISA positives further confirmed by LCMS equipped advanced laboratories. MPEDA also runs hundreds of training programs to educate farmers about banned antibiotics and residue risks. Pre-harvest testing began around 2010, but major upgrades came after 2017, like GPS-linked farm IDs, digital PHT certificates, and processor procurement rules that require PHT certificates for every lot. MPEDA becomes the middle layer of India's traceability architecture. Then comes Export Inspection Council as the last line of defense before any shrimp leaves India. Now, EIC has multiple rules. Every export batch is sampled and tested for residues in advanced laboratories before shipment. Then a health certificate would be issued only if the test is negative. EIC also audits processing plants to ensure they follow HACCP, sanitation and traceability norms. And they also notify antibiotic bans and enforcement measures. In May 2025, India announced its big antibiotic reform. EIC announced a ban on 12 antibiotic classes and six specific substances, covering the whole chain from hatchery, feed, farm, depot and factory. This legally prohibits their use across the entire supply chain. And right after this reform, India announced the National Framework for Digital Traceability, a landmark moment in the history of Indian aquaculture. So now, India's architecture works as a digital nervous system, uniting CAA, MPEDA and EIC into one integrated and coordinated governance system. As a result, India now has 104 certified processing units approved by the European Union, one of the world's toughest regulatory markets. And this level of EU approval reflects genuine confidence in India's food safety systems, hygiene standards and regulatory framework. So it's a clear external recognition that the system is working better than before. Thanks to our coordinated efforts by government and industry, refusals are starting to show signs of decline. Though there is still work to do. Will the antibiotic problem disappear instantly? No, because India is the size of a continent. Any policy change takes time to reach the grassroots. True reform means owning both the progress and the pain points. And this is the new India we are building. Still imperfect, but moving in the right direction. If this perspective resonated with you, follow along for more such stories from India's seafood sector.